for me, church has always been a safe place where the people I trust the most reside. And so I thank you for offering me grace to come into this space and share some information with you today. So like Darlene said, I am Rebecca Carper. I am from the American Cancer Society. So Darlene asked me to share a few different things with you guys today. So it may feel sporadic, but we're going to bring it all back together, I promise. So at the American Cancer Society, our mission is always to make sure that everybody has the equal opportunity to prevent, detect, fight, and survive cancer, all types of cancer, whether that be, all types of cancer, but we want to make sure everybody, regardless of race, gender, your income, where you live, we want to make sure everybody has access to all the resources they need to be able to survive. And just to kind of piggyback off what Darlene said, your community, I think, is the first primary place that we go for our resources. But at the American Cancer Society, I wanted to bring some other things to add to that toolbox. I think that, since we are in a church, I'll speak outside of American Cancer Society, but for my own personal side, I've always considered doctors and just knowledge as a gift from God. And so for me, I think it's my responsibility to use that gift from God to implement it in my life to make sure that I survive and achieve the mission he has for me. So I wanted to share just a couple of American Cancer Society resources with you guys so that when you do have that day that you get that cancer diagnosis, and hopefully we don't, but if somebody in your family or your friends get that diagnosis, I want to make sure we're all armed with different resources so we know how to tackle it and that we don't just give into the fear that naturally accompanies that diagnosis. So I have a bunch of resources out, papers that you can take back with you. But I just want to talk about a few of them. So American Cancer Society has a 24-hour cancer helpline. So this can be online that you type in, or it can be just a phone call that you call in. It's a live person that talks to you. I think this is an important resource because not only are they there to answer your questions about cancer, we have nurses that can answer those complicated questions because I think doctors sometimes talk high in the sky and all a patient hears is cancer and die. And so this is what that 24-hour helpline is, to call in and say, okay, I need you to walk me through step by step. What does this mean for me? What does this mean for my family? Because that's, to me, the first thing that goes through your mind when you get that diagnosis is, okay, but I have this whole village with me. It's not just me that's going through this diagnosis, it's my village. And so that 24-hour helpline is there to talk you through that, the diagnosis. Where do you go for that community support? If you have worries about paying for it, that helpline is there to connect you to different community resources to walk you through every type of question you have so that you get to focus on you and your healing, not all of the logistics that have to take place. The other resource I wanted to bring up with cancer.org. So this is just a website that offers all information about all the different types of cancers, so that when you do have those midnight worries, you can go on and get some solace in arming yourself with information. And then when that unfortunate diagnosis comes, there's other resources that we have as well. So one of ours is called Road to Recovery. This is a program that if you need a ride to treatment, American Cancer Society will link you up with somebody to provide that treatment or that ride to treatment for free. There's not a cap on how many you can do. We just need to make sure that that is not a barrier that is keeping you from getting the help that you need. And then I know we talked about, there's a lot of survivors here as well. So there's a couple of resources that we have for people all going through and on their survivor end as well. So we have a program called Reach to Recovery. So this program is specific to breast cancer. So when you go through breast cancer, obviously it's a unique experience. And so our Reach to Recovery program lines you up with someone who also has had breast cancer. So they can speak to exactly the experience that you're having. You can ask them questions. just lean on them for support. But it is, like Darlene said, to build that community of people around you to make sure you're not doing any of it alone. And then the last one of the resources I wanted to mention is the Cancer Survivors Network, because yes, you get the diagnosis, you go through the treatment, but we know it doesn't end there. This is a part of your story, and that's a beautiful thing, but we want to make sure that you continue to have that community of people around you that continue to lift you up. And so that, again, is just a network of survivors that you can lean on for that continued support. So like I said, I've got all these different resources. That's a lot of information. I've got nice little handouts for everybody if anybody wants to see the different resources that we have and more. The other thing that Darlene asked me to talk about today is I have been told that there are members of your congregation that have ovarian cancer and pancreatic cancer. And this event brought us together for breast cancer, and Corrales is going to talk to us more about that. But when we think about cancer, it's not just breast cancer. There's a lot of different types of cancers that impact our lives, and we need to have as much information that we can about anything, so again that we have the information to take action on. So I just wanted to share just a few things about ovarian and pancreatic cancer. So for ovarian cancer, no? Okay. 1 in 87 women will be diagnosed during their lifetime, and more than half of those diagnosed will be over 63. And it is more common in white women than Black women. So these are a lot of information. But unlike breast cancer, ovarian cancer, we don't know the exact cause of it, and we don't have a screening test for it. Trust me, researchers are working on it. We're getting closer. But I think one of the things that we can do when there aren't given tests for us to stick to, we can understand how we're at risk and understand what steps that we can take, because that to me feels scary when I'm like, well, what can I do about it if there's not a test that I can actually take? What can I do? So some of the risk factors, like I said, are age. Your body weight can be a risk factor. Having children later in life or not having a pregnancy at all affects your likelihood of getting ovarian cancer. Your family history of ovarian cancer, but also your family history of breast and colorectal cancer also increase your risk of having ovarian cancer. A couple of things that actually decrease your risk for ovarian cancer are being on birth control and having completed pregnancies. So for ovarian cancer, the symptoms usually don't show up until it is progressed, until a tumor's gotten larger, until it's spread. Some of those symptoms can be like bloating, abdominal pain, urinary symptoms. But we don't want to get to that stage. And so I think the best thing that we can do is lean into your medical team. If you do not have a primary care doctor, and I know I'm in the same boat as I think a lot of people, it's hard to find one that you trust with telling everything, because it's intimate things about yourself. But find a medical team that you trust to tell everything to. Because the best way to find those cancers early is to have those regular pelvic exams, to understand what your normal body feels like, so that if anything is off, go in and have it checked out. And more than anything, and I would say, and this is across all cancer types, we have to advocate for ourselves and for our family and friends around us. So when a doctor, as women, we tend to be overlooked. Our pain is very often diminished. Make sure you advocate for yourself and know that there's a difference. And if a doctor is not listening to you, find one that will. So for pancreatic cancer, it's a very similar situation. It's 1 in 60 women will get it. There's not a test per se that can find it. And pancreatic cancer is a difficult one because the pancreas is so small and deep within your body. It's not something on a regular exam that a doctor will feel. And so it's a harder cancer to diagnose, and it's a hard cancer to treat and survive. But pancreatic cancer is a good case of something we can do. So 25% of pancreatic cancers are thought to have been caused by smoking. And so we always attach smoking to lung cancer, which we rightfully should, but it increases your chance so much of getting pancreatic cancer as well. In addition to, similar to ovarian cancer, your age, your weight, your family history and genetics, those all have contributing factors as well. But I think with, the purpose of these kind of events is to lean into not the fear of what can happen, but arm ourselves with what we can do about it. So November is Lung Cancer Awareness Month. And so I would say if anybody smokes or if you know somebody that does, there are a lot of resources, both at the American Cancer Society, hospitals, all over, to help you quit smoking, so that we can decrease that risk. And the last thing that I wanted to talk to you guys about, now that we obviously, we know that cancer's a horrifying diagnosis, and I am speaking to the choir when I say that Black women often get forgotten and overlooked, especially within our medical and healthcare systems. And so at the American Cancer Society, we recently launched a study. It's called The Voices of Black Women. So this study it's all about understanding what you face in your day-to-day lives. We have a great advocate at the American Cancer Society, and I'm going to steal her words because she explains this better than I do. So she talks about in medicine, we always have research and clinical trials, and standard diagnoses and treatments, and a lot of these, by far, are created based off of white people. And so we need to know what Black people, and in this case, Black women specifically, what you experience. So Anthony, the woman I spoke of, the way she explains it is if you want to drive around Philadelphia, you're not going to use a map of Pittsburgh because it's not going to get you anywhere. So we have to work together to make the map of Philadelphia to get us where we need to go. So this study, like I said, it's called The Voices of Black Women. It's an online survey-based study. And it's all, the questions will ask you things about your medical history, but it goes beyond that. It asks you about what types of emotional and social support do you have in your life? What is your physical environment like? What does racism in your life look like? How are you experiencing that? Because we want to make the connections, because we know cancer outcomes are a lot worse for Black women, but it's not just cancer outcomes. It's, heart, diabetes, a lot of them. Black women have worse outcomes. And when this study came to us, I was like, finally, we're putting our money where our mouth is, in my opinion, to say you are a priority and you have been overlooked. So let's step up, frankly. So the study is recruiting 100,000 women across America. It's Black women between the ages of 25 and 55 who do not have a history of cancer. So if you know anybody that might be interested in learning more who doesn't have a history of cancer, I've got lots of flyers to share. There's a lot more that I certainly did not explain. But if you have any questions for me, just let me know. I'm happy to share more about it.
Thank you so much. Praise the Lord. That was good. That was good. Amen. And like I said, one of the young ladies, Diane, she was at our job maybe like a few weeks ago, and she was talking about it. And then I went to the American Cancer Society. It was awesome. Oh my goodness. The community there, my son and Elder Chocolate went with me, and we were blown away. We were blown away. It is very, very good. And I met her again, and she definitely wanted me to make sure that we talk about Black women. Black women, and I'm not a doctor, But Black women, yes, it is said that more white women get cancer, but more Black women die. And it's an issue with that. And so we have to catch it. If we catch it at an early stage, our percentage of surviving goes up. And I'm not going to steal Corrales. I'm not going to steal what she's going to talk about. Amen. Because she's much more qualified than myself. So at this time, I'm going to call Corrales Bass. She's going to tell her. I corrected it. I corrected her name, but I never printed it out. So I do apologize. She's from Jefferson. And I do want to also acknowledge Yahweh's song. I met this woman a couple years ago, and I was getting on her the whole time. I said, "Do you know that your name means God?" I said, "This is awesome that we met." Amen. Because every time they call you, they're saying God. Amen. So give her a clap. You don't know. You're in the right place because God is using you to bless his people. And she is so nice. Amen. When I met her, she came to the other one that we had, and she's here again supporting her colleagues. So I do appreciate you coming, Yahweh.
No, and I completely agree. Yahweh is great, but so is also Rebecca. Can't forget you.
I apologize. We want to sanitize.
Kind of go through points and make sure I'm following everything. There are some images, so I might put my laptop actually in the bottom, and that way everyone can see. No, but right here. Okay, it's small. I apologize, but this gives you an idea. So for everyone, my name is Corrales Carcana Barbosa. I'm with the Sidney Kimmel Cancer Center at Jefferson Health. And so the goal today is to just promote more awareness and education on cancer, specifically breast cancer, which is what we're here for today. And so my work is actually a community outreach coordinator. I'm out in communities and we're trying to promote that awareness. We're trying to connect with different communities from different locations. What are your needs? What are the cancer needs you found? Would that impact your community? And how can we actually make a change? How can we better connect you with resources that you may need as it relates to cancer? And so that's really the idea behind the work that we do. And that's why we are here today, to just talk about and creating this awareness. I know a lot of you may be cancer survivors, so this may be a bit repetitive for you, but it's still good to know for either yourself, family members, what they need to be looking out for. Please, I am very much asking questions as you go along. Sometimes you'll forget a question. You'll be thinking about the question the entire time. It happens. Talk to me. We want to make sure everyone feels educated and empowered after this session. Okay? Alrighty. So let's start with what is cancer. Does anybody actually know what cancer is? You don't have to answer, but there are no wrong answers. No? Okay, no worries. That's what we're here for. So cancer is actually just changes in our cells. And it's so much changes that it comes into an uncontrollable growth that actually ends up being and creating this cancerous thing that can then change and then go throughout our entire bodies. It can start in a single location and even expand upon to other locations. And that uncontrollable growth is actually what the cancer is. I bet some of y'all didn't know that, but now you do. So there are so many different types of cancer, and each different cancer has different treatment options, different ways we want to go about it. So, there are standard ways to go about cancer, but for each individual person, there are a multitude of factors that are involved. And so we want to make sure that each of the treatments that we offer are unique or actually work to that individual. So we offer so many different cancers. There's so many different types, different treatments. And it can also develop at anywhere in the body. So that's another thing as well to keep in mind. There are some estimated cancer rates for any in the United States. The largest rate for cancer is actually skin cancer. And it's actually one of the most easily preventable. You know, we need to make sure that we're putting on sunscreen, making sure we have long sleeves. All of those play a role and can lower our risk to develop skin cancer. That being said, for women, the second most common cancer is breast cancer. And so that's why it's important to have these conversations so that we can better address, okay, what are the needs in both men and women, and how can we address that? And so here is actually then what causes cancer. So there's so many things that can actually cause cancer. It's not a one individual thing. It's multiple factors. Now, there are some genetic risks. About 5 to 10% of cancers are actually related to a gene that is passed down within the family. But the other 90 to 95% is actually based off your environment, your lifestyle behaviors. What can we do? You know, so maybe the food we're eating, the environment we're at. Let's say we're in a place that there's a lot of smoking, you know, there's a big factory that's puffing out these smokes. All of those play a role. What are we doing? Our physical activity, obesity, alcohol consumption, smoking, as mentioned, all of those play a role. And so that's the idea. There's not just one thing that, oh my gosh, I got this, now I have cancer. No, there was a lot of factors that created essentially then the actual cancer. It wasn't just one thing and done. Okay. So then why is screening important? You know, so there are actually so many reasons why doing our cancer screenings is important. One of the biggest things is actually that screening can catch a cancer before there's any symptoms. And that's the biggest takeaway, is that before we even feel something's wrong and happening in our bodies, we can actually detect the little cancer growths that are happening. And by catching it earlier, there are so many more treatment options. There are so many more ways that we can help lower that risk afterwards, to the point that we can either completely cure the cancer or have it be at a very steady rate that it'll continue going from. Yes. Okay, yeah, I had to make sure I was on the right page. Cancer screening can actually save lives. The amount of cancer screenings that we do, there are so many different options, 2 different cancer screenings, and by catching it early, we're making sure that we can elongate our lives. Any questions so far? No? Comments, concerns? Okay. So another thing is there are a lot of recommendations to the cancer screenings. Who makes those actual recommendations? Now, I know American Cancer Society does provide their recommendations, but according to our work, and especially with insurance, the ones that are followed through are with the United States Preventative Task Force Group. They're the ones that actually determine what the guidelines should be, and they go based off a lot of evidence and research that's being done. Of course, research is still a little behind, so it may not necessarily be as early as maybe I would recommend personally, based off what we've seen, but it is based off currently the research we have, and making sure that then we are making those changes accordingly. So that's really who we're determining our information from. And the reason why I want to mention it is because a lot of times that's what insurances will actually pay for that cancer screening. So it's important to keep in mind with that. And so now we're on to the actual important aspect for breast cancer. So for breast cancer, it is, again, the second most common cancer in the United States for women. And it's very much just a mammogram. It's recommended to start at the age of 40 if you're at average risk until you're about 75. And the way it works is you will be putting your breast on a plate, and they will do essentially imaging tests to look at the different tissues that are happening. Now, it may be very uncomfortable for a lot of women, and that is very much an acknowledgement we need to have. But it is important to do at least once a year, and we can make sure that our tissues are okay, that there's something, if there is something, we can catch it early. And that's really the biggest idea behind it. Now, it's also important to recommend that there are some self-exams that we can do. And so what that means is that us as women should be going at least once a month and checking our breasts ourselves, making sure we know what our normal is. And from our normal, we can determine if there's actually an issue happening. a lot of times women will end up finding their own lumps and bumps because they know what's normal for them and they know when something feels wrong. And that's why it's so important to make sure that we do our own self-breast exams. It's always recommended to do it a couple days after your menstrual cycle if you still have one, just because sometimes hormones during the cycle can actually create lumps, and that doesn't necessarily indicate cancer. So it's recommended a couple days after. Another thing we want to mention is dense breast cancers. And so a lot of women, actually, especially African American women, have denser breast tissues. And so what that means is we have more fibrous glands, more in tissues happening that make it a little harder to see during the radiologist. And that's why it's so important. I think it's actually talked about it, yes. So that's why it's actually so important. When someone has denser breasts, you can't actually necessarily see, and it looks like a lot of clumps. And so sometimes doctors may be like, oh, well, maybe this could be cancerous, or they can't see if there's a cancer on there. And so that's why it's important to actually have and like do further testing as well. Actually, as of September 2024, mammogram reports do require doctors to include whether or not you have dense breast tissue. And so from now on, we can make sure, okay, we actually have dense breasts. We can then talk to our doctors and be like, we would need to do additional screenings. And that could include ultrasounds, that could be an MRI, that could be a CT scan. It depends, and it's something you need to have talk with your doctor for, but they do then allow for that additional testing. And because of that, and having it included, more insurances are likely going to be paying for it because it is then a preventative measure. And so that's the really important idea of including it as well. And if you can actually are able to see it all from this image, you can actually see how it becomes a lot harder to detect. And while it's still important to do your mammograms, especially consistently, because that way you know, well, if your breasts are constantly looking like this, then you're normal. And maybe they're still able to actually detect if there are any changes if you continue routinely to code through. But it is important to know that there are additional tests that are being offered for women. So now there are a number of ways that we can actually help lower our cancer risk. And one of the biggest things here is to remember that there is both environmental and genetic factors that go into it. So I'm going to focus on environmental risk factors that we can do, as well as what we can do in terms of genetics, which seems weird. You're stuck with your genetics. How can I help lower my risk? Well, that's an important conversation. Thank you for bringing it up. So we have here environmental factors, and some of those things can include what we're eating, our nutrition, and I'm sure it's going to be a wonderful presentation, so I'm not going to touch much more about that, but our nutrition, what we put into our bodies, physical activity, if we can help quit smoking. Jefferson actually offers a smoking cessation program. It's a program to help you quit smoking, so you have your resources and tools to actually get you along that path. As well as alcohol consumption. All of these can actually play a role. And we have more information as well on a flyer that I have back in the other room as well. Now, there's also information in terms of genetics. Now, this one can get a little tricky, so just bear with me. But genetics, the way that works, everybody has genetics. Everyone inherits their genetics from their parents, mom and dad. Now, if one of your parents may have a gene that puts them at higher risk for cancer, and the most common one known as the BRCA genes. There are a lot of other ones, but I'm going to stick with the BRCA right now just because a lot of people have heard about that one more. So if one of your parents has the BRCA gene and you inherit that, that means that you are now at a higher risk for developing cancer. That already puts you then at a little bit of a disadvantage. Everybody else has a blank slate. You already have one slate that's against you, 1 point against you. So then we have additional risk factors added to it, or if times our cells grow, because our cells constantly growing and changing, sometimes, especially as we get older, it's not able to recover and repair itself as well. And that can also lead into having cancer. That's why cancer is considered more of a later age, older generation cancer, because more of our body has a little harder time actually repairing those cells. And so back to genetics, once you inherit that gene, since you are at higher risk, it does mean that you can then further pass down those genes down the line. And so there is actually genetic counseling that is offered to see if you carry a gene that puts you at higher risk. And so that gene or other genes that are known, it doesn't have to necessarily be breast. Sometimes there are certain genes that put you at higher risk for colon cancer, Lynch syndrome, which is actually a non-polyposis hereditary form of colon cancer, which means that oftentimes during colon cancer, you can get polyps. Now, with Lynch syndrome, you actually don't get polyps and you can still get colon cancer. That's why it's really important to know and have this conversation with your doctors and see if you're at higher risk. If you have a family history with a lot of like, my mom had breast cancer, my dad had breast cancer, you know, first of all, if your dad had breast cancer, you definitely should go get genetic testing. It's a lot less common for men to get breast cancer, but there is still a percentage. About 1% of men can actually get breast cancer. And so that's why it's so important. They can also provide different recommendations as well as to when you should do it. So a little personal example for myself, my mom was diagnosed with breast cancer at the age of 40. She had LCISS34, which is a type of precancer. And she was so young. She had no family history at all. There was no rhyme or reason for what happened, but she ended up having it. And so because of that, and because she was at 40, I decided to get genetic testing. Luckily, I don't have any gene that puts me at higher risk, but because my mom had it at 40, I am supposed to start my mammograms 10 years younger than the youngest person who had that cancer. So I start my mammograms at 30, and I go to a high-risk breast clinic as well. So it gives you these recommendations on what we can do to be more proactive and be more accountable, empower us to actually take control of our lives and on that aspect. Because again, the earlier we can find things, the likelier we have a chance of survival as well. And since for Black women, it's higher death mortality rate. It's why it's so important to talk about this prevention, because we want to make sure we can catch it a lot earlier, better outcomes, higher survival rates, and that's what we want. Again, Jefferson does offer a genetic counseling service program that you can talk about, but we also offer other programs. So we also have a mobile screening van. This is a giant, like RV size bus. And this bus actually then provides completely free screenings. Okay. We offer mammograms. We offer prostate screenings. We offer skin, head and neck. And we actually just started cervical in New Jersey. Hasn't been added to PA just yet, but we're on trying to get that in the works. And this, we can actually see patients regardless of whether you have a PCP, regardless of your immigration status, regardless if you're underinsured or uninsured. We will see you. We get enough grant funding to cover the patients who don't have the resources for it. And that's why this is a really wonderful resource that can come out to the community. We work very closely with the Delaware County Health Department. Helen's here for it. And so we work so closely to make sure we provide these resources and connect with the community and get you the resources. The best part about that, van, is, besides the really wonderful people in the work as well, if there is an abnormal finding, we don't just tell you, oh, you have an abnormal finding, that sucks. No, you get enough resources. We will help you along the way until we get that diagnosis. If it ends up being cancerous, then we'll even go further and connect you, with patient navigators to make sure we can get you financial assistance, financial programs. So you're never alone during that process. And that's the biggest thing, is we are going to be there supporting you the entire time. Now, we also have another program that we offer. It's with the Healthy Women's Program. It's actually in connection with the Pennsylvania Health Department, and we provide free mammograms and pap smears through this. There are certain criteria. They go through the state. You do have to be like minimum of 40 for women for breast cancers and 21 for cervical. But it is a resource that is provided as well for underinsured and underinsured women. So if you are interested, we do have flyers for that one as well. I also want to mention our Cancer Support and Welcome Center. And this is for all of our cancer survivors, caregivers, patients. This one's for you. So we have this support program to offer resources, programs that support and provide these services after, as you're dealing with the cancer or after you've dealt with the cancer. It is in the Honickman Center, the actual physical location, but we also offer virtual programs in different locations. So maybe you live a little closer to like Abington. They do offer cancer support services in that location as well that are virtual or in person. And they also offer like nutritional programs, seminars, exercise programs, mindfulness programs. You can do massage, Reiki. The list goes on. They even provide financial assistance or transportation assistance programs as well. So again, throughout any time of the process, you are not alone. And we are making sure that we can connect you with wherever you need to be connected. And so that is a little bit about us and our Jefferson work here. Anybody have any questions? Yes, ma'am. Hello.
You have to know exactly specifically in your body what type of cancer that you're looking for. It can be detected. You're going to say, oh, well, you have breast cancer.
For the screenings, you mean? So with the screenings, the way it works is the guidelines will determine specifically for which type of cancer they may recommend. So there isn't unnecessarily, so for the mammograms, they are looking specifically for the breast. And they will check, everything. But they're not going to, like, if you're checking the mammogram, you're not going to be able to check the leg. It just does not work. So the screenings are individualized to each of the locations. Does that help? Excuse me. Right. Preventative. Yeah, no problem. And now I do want to mention, so this presentation did focus primarily on breast. There are different screenings for the different, like certain body types. So for cervical, it's recommended to do a pap smear between 21 and 65. For colon, it's about 45 to 75. Prostate is about 50 to 70. Now, depending on the risk factors, it can start earlier, and that's important to note. One thing that was mentioned is, like, for example, pancreatic cancer. There currently aren't any screenings for pancreatic cancer. And that's mostly because there hasn't been enough research to determine an actual screening that can be detected. So unfortunately, there are some different localizations that you have to see if there's a symptom, and that will determine, okay, I need to go see a doctor. I saw your face freak out a little bit there. So for example, you are feeling really sick, you're coughing a lot, you're vomiting, that can then indicate, okay, maybe I should go see my doctor. And maybe it's instead like a different body part. I'm not as well versed. Like maybe it's a bile duct cancer, So unfortunately, there are some cancers that are symptom based, unfortunately, because at this current moment in time, there isn't enough research to determine a screening guideline for them. So that is a real unfortunate reality. Again, this is why research, we need to catch up on the lives that are happening now. But there are a lot of screenings for the ones that are a lot more common. So a lot of the cancers I've mentioned that you may have an issue are a lot more rare, and that's important to know. The chances of getting it are significantly lower because it's like maybe 1 in 100 million people. It's very, very rare cancers. But the breast cancers, the lung cancers, colon cancers, these are a lot more common cancers. And those are the ones that we do provide screenings for. Any questions? No? All right. Well, thank you, everyone. Thank you for having me. I hope this sounds useful. I will be emailing this presentation as well to Darlene to send out, so that if you have any further questions, you want to look at the pictures a little bit more, we do give out that resource as well, so you have them. Okay? All right. Thank you.
Can everybody hear me? Yeah. Okay. I'm going to stand up here because I like to walk around. So my name is Erin Pellegrin. I'm the Senior Director of Culinary Nutrition and Education at Unite for Her. Is anyone familiar with Unite for Her? Excellent. Handful. Okay. So before I get into nutrition and all the fun stuff, there'll be plenty of time for questions. I want to share a little bit about what we do. So we are a local nonprofit. Actually, we started locally. Now we are a national nonprofit, and we support those with breast and ovarian cancers. And we do so by providing education, support, integrative therapies to those that are diagnosed. Lots of education. We are a very education forward program. I am a registered dietitian by trade, and I'm a team. We have a team of 4 registered dietitians, so we do a lot of nutrition education, counseling. That is a very robust part of the services that we offer. But we also offer integrative therapies like yoga, Reiki, counseling, medical acupuncture, oncology massage, sexual health counseling. We offer nutrition services like meal delivery, vegetable delivery, gift cards for groceries. So we really try to be meaningful and thoughtful in the support that we offer. So if anyone is not familiar, if you've been diagnosed with breast or ovarian in the last 18 months, you can register and apply for our program. And that comes with a wellness passport, and you can use your passport squares for whatever services speak to you. You know, we give you this array of integrative therapies and support, and you have the option to choose what you want to pursue based on your needs. And for those that may be living with stage 4 metastatic breast or recurrent ovarian, that passport and those services are good for the rest of your life, or as long as you need us, because we know that treatment, health, that will go on, that will change, your needs will change. And we want to make sure that you know that we are always by your side. So that is forever available to you. So uniteforher.org. If I have a table out there as well. So if you have any questions or you want to inquire more about it, let us know. In addition, like I said, we're now national. So we have members in all 50 states. I always say, like, I look forward to connecting with my lady in Hawaii every month. I'm like, how's it out there? It's freezing out here, like she's like, oh, it's wonderful. So we are really grateful to be able to continuously grow and support those across the country. But we started outside of Philadelphia. This is where we were before the pandemic, which, although difficult, was our best teacher. It allowed us to transition to provide these services virtually as well. One last thing. So I do nutrition counseling and education. I also lead our education program. We put on virtual education programs every month, several of them. This week, we have our speaker series. One of our licensed professional counselors, Cassandra Bolding, she will be speaking to us about breast cancer in Black women, societal pressures and stressors. It is always open to the public. It's on Zoom. It'll be Thursday evening at 6 p.m. Eastern time. Everyone here is welcome to join. If you're interested, if you know someone that may be interested in hearing more about what she's going to talk about, Cassandra's amazing. We've had her speak on a lot of different topics. So we're really excited to have her back. So if you go to uniteforher.org or follow us on social media, you can register. It will be recorded, so you're always welcome to go back and rewatch it. But all of our education events are open to the public. So I like to share that as well. And then, okay, so let's talk about food. So that's what we do about Unite for Her. But like I said, I'm a registered dietitian, so we do a lot of talking about food. And so, we're busy, right? Because there's so many questions and there's so much misinformation out there. So I thought something fun today would be to sort of cover some of the myths and provide a little bit more information about some of the most common questions that we get, including sugar, about our nutrition and different ingredients and cancer. But also there's so much overlap with nutrition education and other health modalities, right? Diabetes, heart disease, overweight, obesity. So a lot of what we educate on can really be carried over to, any person, right? And whatever you may be experiencing or whatever your health background is, if you have any medical history, it's always good and applicable to all of us. So there's 4 things I want to cover today. One is sugar, because it comes up all the time. We'll talk about protein, we'll talk about supplements, and we'll talk about organic. But please know, if anyone has any other questions outside of that, I welcome them, because this can be a confusing and really anxiety provoking space. Okay. So first things first, who's heard the phrase sugar feeds cancer? Right? It's like the first thing when people start diving into nutrition education, it's the first thing that a lot of people hear, or other loved ones in our life that are well-meaning and want to help are starting to say, like, well, you can't have this because it feeds cancer, and you can't, and just to hear that, it's very stressful. So is there truth in that phrase that sugar feeds cancer? It's really misleading, and it's not entirely true. So sugar, carbohydrates feed every cell in our body. So I am using sugar right now to move and walk and talk and to, pray together. And all of our speakers, we are using sugar for energy. If you walked here, you used sugar to move your muscles, to breathe, to think, right? So we need sugar for energy. We absolutely do. So it's not true to say like sugar feeds cancer, because that, now it's like, well, now what am I going to do? What am I going to eat? How am I going to fuel myself? So this discussion is really about quality over quantity. Okay. So when I say quality and we think of sugar, carbohydrate foods, we're thinking of foods that are wholesome, that are minimally processed, that are high in fiber, right? That give a lot of nutrition, that give us sustainable energy. So think fruits and vegetables, think whole grains, our beans, our lentils, our nuts and seeds, right? All of these foods give us high quality carbohydrates. And so this is the type of sugar that most of the time we want to be reaching for. Notice I didn't say all the time, because perfection doesn't exist. And if anybody told me I couldn't have Halloween candy, we would no longer be friends. Right? Like we don't have to be all in or all out. That's not the way life works. And keep this mentality, like as you're thinking of your health moving forward, especially about nutrition. Oftentimes when, we're doing a little bit of digging about like, how can I improve my health? What do I need to think about? Our brain, as human nature, initially goes to, what are the things I can't have anymore? What are the things I have to throw out? I grab the trash can. I'm like, grab the bag, I'm chucking out the pantry. We're missing the point. The things that show up every day, the foods that we eat, the hydration that we make a priority every day, that is the stuff that makes a big impact on our long-term health. Not the Halloween candy that I allowed myself to have because, I don't always reach for a Snickers. It's my favorite, but it's not something I have on a daily basis. I'm not worried about that. It's the stuff that we consume regularly. So use that as empowerment, right? If you can shift your focus to, I'm going to make sure I drink my water through the day. I'm going to make sure I get fruits and vegetables. Maybe I'm going to add some extra seeds into my yogurt or my, whatever I'm having for breakfast. You can make these little additions, and let me tell you, they make a big impact. The same goes for sugar. So allow yourself those indulgences. Give yourself permission to enjoy like the family recipes. We are coming upon holiday season, right? There will be a lot of gatherings and love and memories. And when we gather as a family, where do we usually end up? In the kitchen, right? We all do it. So embrace those gatherings and the recipes and all of the memories that come along with it, knowing that, this isn't stuff that we necessarily have every day, and that's okay. So I'm going to enjoy it, enjoy the experience, and feel good about, but I'm going to make sure the other days of the week, I really prioritize making high quality food choices. Does that make sense? Okay. Let's move on. Number 2. So sometimes we get the question, so our mission at Unite for Her, we're very plant forward, meaning really making space on our plates and our meals and our snacks for plant foods. So sometimes we get the question of, well, like, do I have to become vegan or vegetarian now? Right? You don't. If you want to, that's great. And you can absolutely get all of your nutritional needs from following, strictly a vegetarian or vegan, but you don't have to. Okay? We can all really benefit from having an extra serving of a vegetable or a fruit, or, making, like, adding an extra serving of beans into our soup or stew that we're making. We can all benefit from that. It doesn't mean we have to entirely exclude a major food group. So when we think about our animal proteins, this is where heart health really comes into play. So as you are thinking about where am I going to get my protein, which is a really important nutrient, right? Things like our hormones, our muscles, neurotransmitters that work through our body, cartilage, collagen, our hair and nails. It's all made from different types of proteins. So we want to make sure we're getting it from a variety of food. But some of those protein foods are higher in things like saturated fat, sodium, and that really starts to affect our heart, and our heart is our center. We always want to be thinking about protecting our heart, because for anyone with a diagnosis, our medications can affect our heart health long term. Women in general, whether you have a cancer diagnosis or not, if you are entering in or into menopause, estrogen plays a huge role in heart health, in our lipid balance, which is why women, as we age, we are immediately at an increased risk for heart disease once we enter upon menopause. So we really want to be thinking about how we can support our heart health. So think leaner proteins, poultry, fish, shellfish, and minimizing things that are higher in saturated fat, red meat, cured meats, breakfast meats, they're higher in sodium. Again, they're higher in that saturated fat, so minimizing them. Again, notice I'm not saying cut them out altogether, but reach for them less and maybe lean a little bit more into proteins that are more heart healthy. Think low-fat dairy, and of course, all of our plant proteins, right? Our beans and lentils, nuts and seeds especially. Listen, we often overlook the mighty seed, chia, flaxseed, hemp seed, sunflower, sesame, pumpkin seeds, right? They are wildly nutrient dense. So eating just a little spoonful, you don't need a lot. A little goes a long way. Add a spoonful to it, and boy, you reap the reward. Okay, so always think about your heart health. Any questions about that? Okay. How about supplements? Sometimes we hear also, well, what supplements do I need to take? Or I need to take supplements in order to be healthy. And I know American Cancer Society, a lot of our national guidelines, and we concur with this, don't look at a supplement as a prevention for cancer, as a replacement for healthy eating. There's certainly a place for certain supplements, and our dietitian team gets these questions a lot. And I would say, if you're interested in supplements and perhaps learning a little bit more about if you need them and what they are, talk to your medical team. Or maybe your oncology center has a registered dietitian on staff. Wouldn't that be nice? Or your general practitioner, if you see an endocrinologist, there's usually a dietitian on staff or there as well. They can help you. But ask, do I need them? If so, how much? Now, some of the common supplements that we often talk about and can be warranted, one includes calcium. Because again, with hormones and how they may shift with a breast cancer diagnosis, or for women as we age, estrogen plays a huge role in bone density, right? So as we enter into menopause, increased risk for osteoporosis and osteopenia. So calcium may be warranted. So that is certainly a nutrient that I say you absolutely want to talk to your physician, because it's also not something that we willy-nilly want to take, because calcium is really important, not just for bones, but regulating our heart rate. So too much is not a good thing, but that can really be supportive of bone density. Vitamin D. Who's had their vitamin D level checked recently? Good. Great. Okay. Excellent. Many of us haven't. Many of us are deficient in vitamin D because we do make it in the sun, but where we live in the hemisphere, a lot of times doesn't give us enough sunlight exposure. But we also want to be mindful of our skin health, right? And sun exposure can increase our risk for skin cancer. And vitamin D, unfortunately, isn't found in a lot of foods. So supplementation often is warranted. But before you start, you always want to find out what your baseline is. Where am I? How much do I need? And then go from there. Annually, a vitamin D level is really all we need, but definitely something that we are learning more and more about the link with varying health issues and why being within normal limits is so important. Okay. Question? Okay. Mhm.
I just started getting my vitamin D check probably within the past 4 years. They don't give that to you when you're doing your whole thing.
They do not. You have to ask for it. Correct. Yeah, sometimes they will if they do a little bit extensive, but it's not baseline and it's not part of a comprehensive medical panel or a CBC or anything like that. So ask, take a look in your portal, see what your labs show, and the next time you go in and grab labs, say, hey, could you like throw a vitamin D level in there? I want to see where I am, right? Because of the role it plays in so many other instances, okay? So yes. So great question. So the daily recommended intake for vitamin D is 400 international units, IUs, general baseline for adults. Okay, so if you take a multivitamin, usually there's 400 IUs. That is like low level baseline, totally safe number. Once you have that vitamin D level taken, you may need more of that. I had a friend that just recently had her vitamin D level taken. It was 8. Single digit 8. So her doctor started her on super high, like 50,000 IUs just to get her back up. And then she's going to come down, right? But now she knows, and then she'll get that into within normal limits, and then we'll be good. But it's really good to know where you stand. Vitamin D is a fat soluble vitamin, so we store it. It's not like vitamin C that we can excrete when we go to the bathroom. So it's really important to know, like, what's my starting level, and then how much do I need? Yeah. No, I mean, yeah. So it certainly contributes, but it may not be enough for a number of reasons. One, having melanated skin. That melanin and darker skin can impede how well your skin absorbs sunlight to make vitamin D, just by nature of having darker skin. 2, in the hemisphere, so now we're entering into our winter months, so the sun is further away, which affects how well the rays come down and get into our skin. 3, if you wear long sleeves or you have a hat on that's covering your face or you're wearing sunscreen, that impedes that sun hitting your skin. So it's not the best way to use that as the only means of our vitamin D, the way we get our vitamin D. Good question. Yes. There is. I forget what it is. Yes. There is a range. I think on the low end, you're looking at around 30. You might want to be between like 30 and 60. Don't quote me on that, but you're somewhere within there. So even if you're sort of tailing on the low end, your physician may say, we're going to start you a little bit higher, and then we'll retest in 6 months and we'll see where you are and maybe we'll come down. And there's also like a lot of other things that affect vitamin D absorption. If you're on an acid reflux medication, that affects vitamin D. So you may be low by that, or you may need some additional supplementation. So there's all these things that could potentially impede how well we, absorb vitamin D. And so it's always worth having that discussion with your physician. Yes. Yes, so great question. So you might see vitamin D2 and vitamin D3. Vitamin D2 is the type of vitamin D that we store in our body. When we get ready to use it, our kidneys will activate it into vitamin D3. So usually when we take a supplement, you'll see vitamin D3. It's the active form. Correct. Yeah. Yep. And it'll usually be vitamin D3, that active form. Yes. Yeah. Totally. Because 400 is like safe lower limit. Right. That's why I say, like, it's the recommended daily intake is 400. It's a low number. It's safe. It's like, there is little to no risk at this quantity. But, for myself, I take acid reflux medication. My doctor has me on 2,000 IUs a day at baseline. My friend that had hers, she was at 50,000 just to kick off and bring that level up. So you really want to have the discussion, have your testing done to figure out where to start, and then you sort of trend it as you go. Yes. There really aren't any overtly, to be perfectly honest. Now, severe vitamin D deficiency is rickets, soft bones. Typically, we don't usually see that in this country. So in like underdeveloped countries where vitamin D in foods or sun exposure, we may see more of rickets. I have seen, I used to work in bariatric surgery. I had one patient that came in with rickets because with gastric bypass surgery, you have to take supplementation because of absorption issues. She had rickets. She wasn't taking her vitamin D. But very uncommon. And they're really, it's like sometimes if your vitamin B is low, you might feel a little bit sluggish, or if you're anemic and your iron or, that might be low, you feel a certain way. It's not usually the case with vitamin D. Great question. Anything else? Yeah. What kind of milk? Oh, yeah. Yeah, so great question. So milk, so cow's milk is naturally good in calcium and vitamin D. So the question often comes up, well, like if I'm lactose intolerant or I don't like cow's milk and I have almond milk, oat milk, cashew milk, these other plant-based milks, most of commercially made plant milks are fortified with calcium, vitamin D, and B vitamins. So they can actually be a really great source. Great question. Anything else? Okay, so we don't necessarily need supplements. Some may be warranted. Always talk to your physician or speak with a registered dietitian if you're interested, how much that may be. And certainly if you're on other medications, we think about, are there any potential supplement drug interactions? Right? Like grapefruit is one of those foods that interacts with a lot of different medications, chemotherapies. You want to just be aware of what you're taking. And that's especially important for certain herbs, botanicals, where we start to get into that conversation about, are there potential risks of interaction? Yes. Oh, that's a great question. Timing of day, you mean?
Yeah, meaning if you have or trying to put this supplement
Yeah.
because of the
Yeah. Generally speaking, it doesn't really matter timing per se, like fasting or not, or at night or in the morning. Now, I will say our 4 fat-soluble vitamins are A, D, E, and K. And so assuming that you are eating a source of fat throughout the day, it could be from anything, then you have that nutrient that really supports overall digestion. It doesn't necessarily mean that you have to have something fatty when I'm taking my vitamin D. Generally speaking, if you're eating foods with a variety of nutrients throughout the day, you're going to get some of those helper vitamins that work well with digestion. So, aside from that, I don't think that there's any proven science behind timing of day. I think some people may just feel like if I take all of my supplements or things in the morning, it may upset my belly because I haven't had anything in it. Others prefer to take it later in the day before bed. I think it's really personal preference. Great question. With that being said, actually, there are two vitamins that follow the same digestive pathway. So they compete for absorption, and it's iron and vitamin C. So if you do take supplements, like if you are anemic and you're taking oral iron, but maybe you're in menopause and you're like, yeah, I do take calcium as part of my daily routine. You want to space them out, because they will essentially compete with absorption pathways, and we want to make the most of those nutrients that we're digesting. So usually the recommendation is like wait 3 or 4 hours between taking them. Anything else? Okay, we'll move on to our last one, organic. Do we need to eat all organic produce? What about like organic meats? We do not. So one of the common things that comes up in this conversation is, particularly our fruits and vegetables, our produce, right? Conventionally grown produce is not as healthy. That is not true. When you compare the nutritional value, vitamins, minerals, fiber, antioxidants of organic produce versus conventionally grown, they are generally the same. They're pretty much the same. And any slight changes, maybe from the ground in which they were grown, maybe sun exposure, right? Some of those environmental, but it's not enough to really make a difference. And to be perfectly honest, at the end of the day, what I want for you is to eat more fruits and vegetables. I do not care how you get them. So know that if you have a budget for organic or you want to be strategic with a couple dollars in your food budget, you can look at, maybe some of the fruits and vegetables that you eat often, right? Do I eat an apple every day? Yes. All right. Well, maybe if there's a sale on organic apples, I'll pick them up. If not, I wouldn't worry about it, right? So you can be strategic, but you absolutely do not have to, because at the end of the day, more fruits and vegetables, high fiber, minimally processed, that's what we want to shoot for. And you can get your produce in any form. Fresh is great. Frozen is amazing. Wildly nutrient dense. The blanching and freezing process maintains all of the nutrients. And they're cheap. And they minimize food waste. And they're versatile, right? So it's like stock your freezer with fruits and vegetables because it's serving you nutritionally and you just use what you need. You can throw them into different things. They cook in no time, right? So they are like wildly beneficial and really user-friendly to just like keep on hand all the time. Even canned. I always say, listen, never turn down an opportunity to have like canned vegetables. Give them a rinse. They can be higher in sodium, but listen, if you have them, again, really user-friendly, great on the budget, super versatile. It's a great way to get some nutrition. So always just, you don't worry about organic or not. If you're getting more servings in, check you win. Yes. Mm-hmm. Love that. Yes. So yeah. You do want to make sure you're always cleaning your produce. And truly, depending on what the produce is, you could use some gentle like dish soap. For harder fruit, apples or pears or things that don't have a porous, sometimes I just use like a little bit of Dawn soap and I'll just clean the outside of it. Limes, oranges, like that have a harder peel, right? I just clean the outside of it. You could absolutely make your own produce wash at home with some baking soda and some lemon juice or a little bit of distilled vinegar. Oh my gosh, one of my quick ways to do it, 1 cup of distilled vinegar, 3 to 4 cups of water, and then you can soak berries in it for 8 to 10 minutes. Use your greens, clean them 8 to 10 minutes, spin it out. It's not going to make your produce taste like vinegar, but it really cleans the outside and it removes all of the pesticides and dirt and residue that may be on it. You can also buy, like on Amazon or Trader Joe's has some of their own if you want to go down that route as well. But if you check the ingredients, it's usually stuff that you can make at home. It's using like vinegar and lemon. So, why waste your money? But yeah, really, really, really easy. Yep. But definitely want to make sure you're always cleaning your produce, even if the bag says triple washed. Give it a rinse. Invest in a salad spinner, right? Like don't buy the produce wash, get the salad spinner, and then just like spin it out. It's so easy. So you do want to make sure that you're cleaning them. Now, if you are thinking, well, what about our animal foods, right? Like maybe we want to go organic with some of our animal foods. Again, you don't have to. You don't have to buy anything organic. If you have dollars in your budget and maybe that is something that's important to you, you can be a smart consumer. Be strategic with how you spend your dollars. Do your eggs and your chicken and your yogurt and your beef have to be organic? No. Pick one thing that maybe you eat all the time. Maybe you're like a big egg house, a big egg house. You always have hard-boiled eggs on hand. It's a snack, or you have it for breakfast, or you slice it on a salad, or what have you. Okay, prioritize the quality of your eggs. Otherwise, don't worry about it. Or maybe you're a big chicken family. You make it roasted. You might shred it. You make chicken salad, what have you. Okay, if there's a sale, you can stock up family size and you buy organic chicken. Great. Only if you want to. And I always say, more importantly, getting into the mindset of whatever you're making for yourself, ask yourself, what can I add to this to make it healthier? So if you're making fish, chicken, eggs, what have you, can I add a serving of vegetables? If I'm making a sandwich, can I add some sliced tomato, maybe some spinach? Can I have an apple as a snack on the side? If I'm making eggs in the morning, can I throw some peppers and onions in the pan, or some mushrooms or some spinach, what have you? Think about, you don't have to go fancy. You don't have to go expensive. You can always make, again, these little additions that when done consistently, make a big impact. Does that make sense? Yes.
I know a true story of someone that stayed for cancer.
Mm-hmm.
And my mother had breast cancer for 37 years.
Mm-hmm.
And the cancer died, but I changed her diet
Mm-hmm.
from wild performers to wild food.
Mm-hmm.
So that difference
Mm-hmm.
with cancer, how do you feel about it?
Again, I don't think it's necessary. It's certainly a personal decision. And I'm hesitant to look at one food change without looking at the big picture of everything else that's coming in. You know what I mean? Certainly that's a great quality upgrade, and it's a health, for you, it's an important part of a bigger picture of food and nutrition. But as we've heard before, health and cancer, there are so many avenues that may contribute to the diagnosis and what that looks like for an individual. So I think if that's important to you and you wanted to make that change, absolutely, we support you. Like I said, I'm hesitant to look at that alone. Right. Yeah. So if there's a lot of things that go into that, I am a believer that food and what we put in our body does make a difference on our health and how well we tolerate treatment, how well we feel, how well we recover from surgery. All of these things really make an impact in the long run. Right. Right. Yeah. Oh my gosh, we've made so many changes and advancements in treatment and surgery and what we know and clinical trials, right? We have made wild advancements, and hopefully we'll continue to see those advancements with other cancers, ovarian, cervical, pancreatic, right? Other areas that don't get as much notoriety as breast, but they're still just as important. What else? Are there any other questions? Yeah. Right. I know. Right. I feel like this is like with coffee and eggs and like insert food. One day they're good and one day they're not, right? Like, I don't know what to do. Right. I know. Listen, I think eggs are great. So particularly this discussion comes up when we look at cholesterol lipid levels. And what do we now know? That dietary cholesterol isn't really the problem when someone has high blood cholesterol. Saturated fat is really the driver of high lipid cholesterol. And eggs aren't really high in high saturated fat. They're higher in cholesterol. So we don't really look at eggs so much as really a driver of what may be bringing up someone's lipid and heart health and their cholesterol. We look at their saturated fat intake. Great question. But again, with that, also I always say, listen, take a step back and really evaluate. Even if you do have high cholesterol, your triglycerides are high, and you're trying to evaluate, if you eat an egg a week, is that enough to really make a difference? It's not. If you eat 3 eggs a day, which, right, delicious. Maybe that's something that you want to think about. Is that a good for me? Is it not? What have you, right? So it's like how often things show up are also part of that discussion. Yes. Brown.
No, not white. I mean, egg white.
Oh, eat the whole egg. Eat the whole egg. I'll tell you what's really cool about eggs. Eggs are the only food in the food chain that contain all fat for soluble vitamins, and they're all in the yolk. Yeah. Yeah. Nah, eat all four. You get A, D, E, and K all in the yolk. And you can make it even better by adding vegetables to it. Right? Like instant upgrade. Yeah. Great question. Yes. Oh my gosh, great. Air frying is great. Air frying is essentially convection cooking, right? It's air circulating. So it is a great way to achieve that like crispy texture that we love in fried foods with way less fat. So it's a way heart healthier method. So if your oven has convection cooking, you have an air fryer. So it's all about circulation. It's a way healthy method of cooking. I love it. Love it, love it. Yeah. Great question. Oh my God, I know. I put everything in the air fryer. Oh my gosh. Yeah, so good. So good. Anything else? Any other questions? I know. I mean, I could talk about food all day. Yes. Great question. So in terms of style of yogurt, it really doesn't matter. Okay. Each style nutritionally brings different things to the table. And so from that regard, it's really a personal preference. Greek usually yields more protein, but not everybody likes Greek yogurt, right? It is thicker. It's got a texture. There's also Icelandic. There's also like our traditional American yogurt that has a little bit of a creamier texture. So style really is a personal preference. If you are looking for a good yogurt, there's two things you want to look for. One, you want to see that it says live active cultures, which means it's got healthy bacteria, so it's a great way to support your gut health. Number two, in a perfect world, it would be plain yogurt, unflavored. I know. Oh, God. I know. I'm so sorry. And I'm done. I had you until now. God. Oh, man. Oh, man. Oh, man. So, like I said, in a perfect world, right? So, like, so, all right, if you're a regular yogurt eater and you're like, I really want to make a quality upgrade, you could go to plain and add your own sweetener. A little bit of cinnamon, add some fruit. This is where I like to use frozen fruit. I let them defrost on the counter. I add it into my yogurt. A little bit of honey or a little bit of maple, right? Good quality sweetener, right? We talked about quality sugars. Same thing goes for our sweeteners. Raw honey, little good quality maple syrup, a little bit. Oh my gosh, now you control the sugar and the sweetener that goes into it. If not, listen, I get it. If you're looking for something with a little flavor, it's just what you like, try to find one with single digit added sugars. Yogurt will always have sugar in it because it has lactose. Lactose is milk sugar. So at baseline, there's always going to be sugar in yogurt. It's the added sugars. If you can find single digits, we're headed in the right direction. Great question. I love that. Anything else? Yeah. Sure. I have. Mm-hmm. Yeah. Yeah. Mm-hmm. Correct. Good. Yeah. Yeah. Absolutely. So yeah, I always think with any sort of herbs, botanicals, you want to really look at what do we know about it and the uses for which they say it's beneficial. So we'll use sea moss as an example. So there are two websites that I often recommend to go for really reliable information and research behind varying herbs, botanical supplements. Number one is About Herbs. It is a website that is run by Memorial Sloan Kettering. They have a ton of research to really let us know, like, what's the science tell us about the benefits of these particular supplements? And are there potential interactions with drugs that a patient may be on? Number two is the National Center for Complementary and Integrative Medicine. It's run under the NIH. Again, you can go do a search, CMOS, insert whatever, and it'll tell you, what do we know about it? How strong is the evidence? What do you have to be aware of? So that you can make an educated decision on what you want to start taking or not taking. Because that's really what this is about, right? We're here to educate so that at the end of the day, you can make the best decision for you. And you can reach out to the support services from the American Cancer Society, from Jefferson, and the amazing work that we all are trying to do for you so that you are empowered with information so you can make the best decision for you as an individual. Yes. Okay. And then the orchestra may start. Although I could talk for all day. Yes. Yeah. Yeah. Yes. Yep. Okay. Great question. Generally speaking, yeah, it's okay. So our artificial zero calorie sweeteners, they can be a helpful place in our diet. So for some, they can be a great stepping stone from consuming a lot of refined and added sugar. So if we're trying to move away from it, perhaps if we're monitoring our blood sugars, and that was an ingredient that showed up quite a bit in our diet, and we're really trying to look at foods that can help to better support our blood sugar, that could be a stepping stone. Now, one thing we want to be mindful of is no calorie and artificial sweeteners are way more sweet on the palate when we compare them to table sugar. So like Splenda is 300 times sweeter than regular table sugar, which means, I mean, it's good to know that, but our palate is really good at adapting to two flavors, sweet and salt. And so if we're using a lot of stevia or Splenda, we could become accustomed to needing things to be sweeter. And we want to move away from that. So I always say, listen, if something like stevia or Splenda or monk fruit, what have you, if they are, like an ingredient or something you reach for throughout your day, try to get to a place where you can use the least amount possible. Okay? Great question. Yeah. So great. So there's not definitive evidence. So there's some research and arguments behind, is there an increased potential risk, but it's not really clear. And so, again, we sort of fall into this like artificial sugar conversation. If that's really a concern of yours, then that can be a goal to work on, to either slowly removing it from your diet and maybe looking at a better quality sweetener, a little bit of honey, a little bit of maple, or getting to a place where you have just the least amount possible, but you're still able to enjoy your food or your beverage or whatever you're using it in. Great question. Say that again. Oh, great. I'm going to be a Debbie Downer again. So sugar in the raw is white sugar colored with molasses. That is marketing at its finest, right? So I mean, again, like sugar in the raw, because that molasses adds a particular flavor, so you may like a little bit of it. So again, like think about how much raw sugar shows up in the diet. If you just use like a little teaspoon in your coffee, and your coffee experience of the morning is maybe when your house is quiet and the kids aren't up, and you're like, this is my time to pray or to like think or show gratitude. Do I want to take that experience away from you? Absolutely not. Right? Because we all need our peace. We all need our moments of peace throughout the day. So again, like if you enjoy that and you're like, it really takes up such a small bit of my day, I won't worry about it. If you're using a quarter cup of it in your coffee, different conversation. You know what I'm saying? So, and that goes with anything, right? That goes with it. It's not what it's all made out to be. It's still refined. It can still be part of a healthy diet, but we really want to pay attention to how much it shows up throughout our day. Yeah. Okay, I know that. Thank you for the orchestra. But I do have information about Unite for Her at the table. We've got some fun samples from one of our beauty products, Secure, or our beauty partners. So feel free to grab some stuff. But thank you.
Did I tell you she was awesome? It's a wealth of information. It's a wealth of information. But we have to move on. They're going to be back there. So if you have any questions, you can go back there and she'll speak to you. So at this time, one of the things that we want to do is that we know that cancer survivors, any kind of survivor, for whatever it is, you have been through a lot. So we want to honor those people. Amen. We want to honor those people. Minister Lene, are you ready? Okay. So I'm gonna give her a few minutes. And Minister Lene is going to minister to us in dance. And just by show of hands, do we have anyone in here that's a cancer survivor? Okay. All right. So if the cancer survivors will stand, I'm going to do this while she's getting ready. So you can come up while she's getting ready. No, the survivors. Because I have some bags for them. I'm doing this while Lene's getting ready. So I have a pen, so we're gonna yeah.